This past week, the National Association of Health Services Executives convened in Detroit for its 29th annual conference. The nonprofit organization is made up of Black healthcare administrators from around the country. Their goal is to promote the development of African American healthcare managers and to improve the quality of healthcare for minorities and underserved communities. Joining me now is the past president of the association's Detroit chapter, Patricia Adams, who's the CEO of Select Specialty Hospital in Flint. Thanks for being here.
Yeah, thank you for having me.
Absolutely. So explain something about this organization's makeup and mission. I'm not sure most people are familiar with it.
Well, NACE,
NACE.
also known as the National Association of Health Service Executives. It was founded in 1968, so it's actually 46 years old. You've mentioned a little bit about the core mission of the organization, which in its infancy and starting phase, or when it actually started, was to promote the advancement of leaders of color in the healthcare industry.
Right.
That is still an area of opportunity for us here today.
I love how you put that, an area of opportunity,
yes,
right?
So the relevance of the organization still exists.
Yeah.
That's the core mission. We have partners as we have evolved throughout, I'll just say across all nationalities, and we welcome anyone into the organization, but that is absolutely our core mission.
Yeah, yeah. So healthcare is a really booming business, and costs are the things that are growing. So what's the backdrop of that change for African Americans and other minorities?
I would say that one of the things that the backdrop for minorities and others, it's about the costs, but it's also about the changing climate of healthcare, as well as the change in our demographic and population. You hear a lot of statistics about how the population of our country has changed.
Yeah.
As our population shifts from one extreme to potentially another, and as it becomes more and more diverse, the need and necessity, more so, for more diverse leadership to help drive and direct the care for those diverse populations is increasingly needed. And so I think that that's one of the real backdrops. As you talk about costs, as you talk about the change in climate, it's really about being able to increase diverse leaderships throughout the organizations. I was listening to some statistics actually day before yesterday, or during our conference, I would say. And one of the things that they mentioned is that leaders of color make about approximately 12% of all leaders in healthcare across the nation.
Is that right?
And so when you start to speak about statistics like that, as you look at the population that's increasing, we have I'll just say an area of opportunity. I'll use that term again.
It's an imbalance, right?
Yeah, there's a little bit of an imbalance.
Right.
So it's absolutely critical, and that's one of the focuses of NACE. NACE creates, as an organization, creates a forum where you have, we're attempting to grow, nurture, and develop leaders of color and give them an outlet and access to other leaders of color that have progressed throughout their careers. And it's you know, it's almost like each one teach one, I guess I would say. So.
Right. You know, this is all a very familiar topic to me because I'm the son of a healthcare administrator. My mom was director of nursing at a small hospital here in Detroit for a long time, and I can remember her talking in the 70s and 80s about opportunity and the need for more opportunity. She was the first African American in her post at her hospital, and that was sort of going on in lots of different places.
Yes, and it's still an area of opportunity. It still exists.
It's better.
And
it's better now. I mean, I seem to see lots more administrators. You know, you go to the DMC now. There are African Americans leading the hospitals there, and that was not true when my mom was working in the 70s and 80s.
Yes, that's absolutely certain.
Yeah. How does the Affordable Care Act change the picture for this, or does it?
I think that it does, absolutely, because what it's done is create greater access. So there are people in the communities that we all serve that did not previously have direct access. Everyone has always had access to the emergency room and have historically used that in times as their primary care or primary point of access. However, what the Affordable Care Act does is creates access in the appropriate place. So it's almost like right time, right place. So they have access to providers. They can go to seek primary care that will help hopefully prevent an emergency room visit, which is what we all want. So in looking at that, that's one of the things that the Affordable Care Act does, because it increases access for all.
Yeah, yeah. Is the opportunity to increase more the number of African American administrators and executives? Is this still a question of just of people identifying that, hey, I could do that at an early enough age, and thinking that way? I mean, I feel like in so many fields there's still that barrier that people just don't think, hey, that's for me.
You know, absolutely. Interestingly, I think that what people do not realize as it relates to health services, and it's one of the things that we've been working on as an organization and creating some partnerships, and recently expanded a partnership with the En-ROADS organization, is that we're trying to get to people at a younger age so they can acknowledge or understand that although they may want to be an attorney, an accountant, or whatever that is, that there are places and roles for those professions within healthcare.
Within healthcare, sure.
Yes,
right.
Business administration, health service administration, and being aware that those are absolute viable careers and that they're actually needed in healthcare.
Right.
Yes.
Right. What were some of the highlights of the Detroit conference that just wrapped up?
Oh, there's so many. Our conference is always so awesome, but as you know, our theme this year was transformation leadership. Be the change, so from volume to value, be the change. And I think one of the things that was really stressed is that we as leaders have to actually be the change that we want to see. So sometimes that may mean stepping a little bit outside the box and pushing for that change that you want to see. So that's one. We had some great guest speakers that came in. The 3 doctors were with us and did a great presentation. A few other presentations. One of the things that I really enjoyed was we talked both to our mid-careers and to our senior leaders about what are the characteristics of the leaders of the future as it relates to healthcare.
Okay,
so,
that's an interesting question.
So historically, you may have thought of leaders in healthcare, and you mentioned your mom was a nurse director or director of nursing, is that you would look more at the technical skills. So you had to have certain experiences, certain technical skills in order to be a leader in healthcare. Well, what's needed as things are evolving and changing are more actually the softer skills. So it's some of those things that you can't actually teach.
Right.
You have to, you can grow them, you can inherently have them, but it's some of those other skills that will really set the next leaders of the next generation apart from others.
Wow,
Yeah.
wow. And so how do you reach people with those with the development of those skills? That's
I think
different.
it's starting early.
Yeah.
It's starting early, having them to understand that understanding and being in tune to how you treat people and how you understand and being active listeners and some of the other characteristics, that it's not simply about being able to perform and do a job. It's really more about understanding who it is that you serve and being more of a servant leader and being self-aware, because we all know what our strengths are and what our weaknesses are or opportunities are. And I think as you become more self-aware, that will help to enhance that and helping to increase the message around having self-awareness as well as being aware of what, not necessarily what you think people need, but what do people think they need.
Well, and you know, that's those are skills you need in any industry, right?
Absolutely.
I mean, it's not just in healthcare.
It's not just in healthcare, but I would say that those are items that other industries, have historically focused on and acknowledged.
More, I see.
However, it's an evolution for healthcare, whereas healthcare is historically focused more on the technical skills versus some of the skills that the other industries have focused on. So we're getting there.
Yeah,
so.
yeah. We've got about a minute left. I'm curious, what do doctors feel, or how do they feel about health reform? I mean, we hear a lot of things about that, but you're sort of on the inside of this. What are they telling you?
Well, I would say that you get mixed stories.
Yeah.
So there are some that are very pleased with the fact that there's increased access and that you're not seeing people walk in who could have been things that could have been prevented, but because they did not have access to a primary care provider,
now it's
an emergent situation, or they're at stage 4 versus this could have been seen, at stage 1 where it was, treatable, and now there is not a treatment. So you have that element of it. So that's some of the positive. You have others that are concerned that although there's increased access, that there's not enough providers to provide the access. So you have access, but then you also have access constraints.
You're creating demand,
exactly,
and there's not maybe enough infrastructure to service
absolutely. So that's one aspect. And then you have those that says, okay, you've created this access, and for the population, however, the reimbursement associated with the access is not enough to sustain the business. So, or now I'm going to say sustain the business, because healthcare, we mentioned, it is a business, although our business is caring for patients.
Okay. Well, thank you very much for being here.
Oh, and thank you very much for
having me. Congrats on your conference.
Oh, thank you very much.